Hello, my name is Bob Byrnes, Mayor of the City of Marshall. I'm here with Dr. Steve Meister, who is the Chief Medical Officer at Avera Marshall. Steve, of course, is also a member of the Marshall City Council, so welcome, Steve. We're here today to talk about the COVID-19 coronavirus, which has, of course, been in the news around the state, around the nation. We're here to talk about the planning that's going on in the City of Marshall in the anticipation for when that virus does impact this community. So what we'll talk about is some recommendations, what the situation we expect to be, and what the city is doing for a contingency for continuity of services should we run into an emergency situation. So with that, Steve, you're the expert.
Well, thank you, Bob, and I appreciate the city's backing of Avera Marshall, and I appreciate the time and the opportunity to be able to educate people. The first thing that I would like to say is that as of today, Thursday, March 12th, 2020, we do not have any confirmed cases in Marshall, Minnesota. There's been a lot of discussion about a positive case in Marshall, and I assure people that as of today, we do not have a case. However, this is like a hurricane. We know that the storm is coming. It's just a matter of time of when it's going to come. So the first thing that I'd like to do is tell people what COVID-19 is not. The biggest fear that we have right now is the fear that people are getting. We need to be careful. We need to take care of ourselves just like any normal influenza. Now, this is potentially a little bit bigger than the influenza. It potentially is a little more dangerous to than influenza with a certain subset of people. However, the most important thing we can do is distance ourselves, stay home if you're sick. If you have a fever, stay home. Please stay home if you have a fever, and especially if you have a cough with that fever. But anytime you have a fever, you should stay home. You're sick, your body's fighting something, so stay home. We have a number to call throughout the Avera system. It's 1-877-AT-AVERA, 1-877-AT-AVERA, and that will guide you to the people who will screen appropriately to see whether or not you need to be evaluated by a physician. The screening process is quite intense because this is, again, a novel coronavirus. Novel means we've never seen it before. We don't have anything similar to it, and so we are taking extra special precautions. My boss, Mary Martins, the Chief Executive Officer of the hospital, along with myself and a host of others in the administrative wing of the hospital, are on phone calls with the Avera system each and every day. Mary was actually on a call with the Minnesota Department of Health and the Centers for Disease Control this morning, and we found out some new information as of this morning from the Centers of Disease Control. COVID-19 is now in 68 countries. The World Health Organization has labeled it as a pandemic. People know the president has put a restriction on travel from Europe for the next 30 days. Just generally, travel has got to be considered no matter where you go. That's one of the criterion for being screened and screening positives is you traveled to an affected country, but that too may change going into the future. There are 45 states currently out of the 50 in the United States that are affected and have documented cases. Hotspots, of course, are Seattle, Washington, and the state of Washington. New York and California have a lot of this disease. So far, there's been 32 documented deaths in the United States of America. That is throughout the country. The people who are most likely to have the severe cases that do end up in fatalities are people who have comorbid conditions and are older. Comorbid conditions mean asthma, COPD, lung disease, diabetes, high blood pressure, things like that, and are older. There's always exceptions, but right now that is what the Centers for Disease Control is telling us. Unfortunately, and this is a big problem, unfortunately right now with the mild cases, there is no treatment. This is viral. There are no antibiotics that cure viral illnesses. They are viral, and that means our body has to mount its own immune response. So if people are concerned, the most important thing that they can do is stay at home and contact that phone number, 877-AT-AVERA, to get guidance of whether or not they should come in and be seen. The exception to that is if you are having problems breathing, if it's hard to breathe, if you've got a really high fever and are coughing a lot and it's difficult to breathe, that's a medical emergency. That automatically gets you to the ER. We're asking people not to come directly to the clinic without calling, because we have healthy people who are in that at-risk population in the clinic being seen. So don't just come saying, I want to be tested. We're not asking for that. That's kind of going into the fear. And if we test you and you're positive and you're healthy, the current guidelines from the Centers for Disease Control, the Minnesota Department of Health, are just to stay home. You're sick, stay home, quarantine yourself, take care of yourself, curl up with a good book, catch up on your Netflix, and if you can video conference into work, do that. That's the best thing that we can do. So that's the gist of what we have to say today going forward. The first thing is, try not to worry. This too shall pass. China just, again, according to the CDC call this morning, China has apparently reached its crest. It's coming down. However, be prepared for a little longer than China. China has draconian measures that they took. They actually sealed people into their houses with a little more aggressiveness than we would ever do in America. So we are still socially mobile. So the best thing, again, is cover your cough. If you see somebody coughing, try to keep your distance away from them, maybe a little bit of a bubble between people. If you are coughing and sneezing and are sick, stay home. Don't spread your germs. This is not the time to share. So that's about where we're at today, Bob.
Well, thank you, Steve. I think just a few messages, and thanks for the great information. I think we're fortunate in Marshall and Southwest Minnesota that we do have the expertise here. We do have a regional medical center. They are doing planning in the eventuality that they have to respond. The city is doing the same so that we can continue services. We do the same type of emergency management for a lot of emergencies, whether it's a flood or whether it's a weather event or whether it is, in this case, a health emergency. If people do have questions, Steve mentioned that number several times. Also, there is good information on the Avera website. We have a link to that on the City of Marshall website. If there are questions, you know where to call. If there's questions or suggestions for the city, contact the city offices. Thank you.